Based on these observations, what did you do next?
I asked him to get out of the car and step to the back. I also asked him if he had been drinking once I noticed the odor, and he said that he had not been drinking. And I said, okay, well, that's fine, and I just wanted to make sure that he was okay to drive.
And did he get out of the car?
He did.
What did you do next?
I asked him to remove his hat. He left his hat in the car. I asked him to step to the back of the vehicle, and he did. He stopped at the back of the vehicle and kind of shuffled his feet. I wasn't sure if he was losing his balance or not. Then I redirected him to a safe location where I started the field sobriety tests.
Okay. Can you describe the area that you gave the field sobriety test at?
Sure. It's a relatively new parking lot, so it was nice and flat, free of debris.
Okay. And this was at 1:30 in the afternoon. What was the weather?
It was a bright sunny day. Beautiful.
So you didn't have to worry about lighting. You could see clearly?
Yes, ma'am.
Was there traffic in the area?
No, none at all.
What tests did you have him perform?
First, the horizontal gaze nystagmus test.
All right. And then after that, did you have him do any other tests?
Yes. A walk and turn, and then the one-leg stand.
Okay. Let's talk about the horizontal gaze nystagmus. Is that typically referred to in short as HGN?
Yes.
Okay, we're going to use the shortened term for now. You indicated you've had training in DUI detection. Does that include specific training on how to conduct the HGN test?
Yes.
And would that be consistent on the dates that you gave us earlier when you received training on the HGN?
Yes.
Did you also receive a training directly from a Dr. Carl Siddick on the horizontal gaze nystagmus, the science and behind it?
Yes, ma'am.
And when was that?
Within the last few months.
The National Highway Traffic Safety Administration, NHTSA for short, what is that organization?
In particular, they're the ones that validated the field sobriety tests. It's their training that you received on how to conduct the HGN test, is that correct? Yes, ma'am.
And you're familiar with the standards that NHTSA uses to train officers to use and administer the HGN test, is that right?
Yes.
As part of your training and experience, have you had opportunities to observe subjects under the influence of alcohol perform the HGN test?
Objection again, Your Honor. We are trying to bootstrap the qualifications of the detective by prior experience.
Well, I think we have covered. Are you rendering an objection to the qualifications of the witness, or are you reserving that, Mr. Costello?
Only as any qualifications as to any police officer giving the nystagmus test.
Very well, then I will sustain the objection. Don't answer that, officer. Next question.
Under People versus McCown, the state's required to lay the foundation that the person testifying to the test has been trained, has experience, training and experience is relevant. So for the record, Judge, that is why that question was asked.
Well, that's why I got to Mr. Costello about whether he's objecting to it. And I understand that you're not objecting to it.
I'm not objecting to the officer having training in it, Your Honor. I'm objecting to observing numerous people taking the test. That's my objection.
As I understand it, the gist of the state's question is to establish the qualifications of the officer with respect to this specific test. So on that topic, do you lodge an objection, or do you acknowledge?
I acknowledge his training.
Very well. And the sufficiency of said training? Or do you reserve that?
I'm reserving that, Judge.
Then I'm going to overrule your objection,
Okay.
and we're back to the question.
Okay, thank you. As part of your training and experience, I'll just repeat the question. As part of your training and experience, have you had the opportunity to observe subjects under the influence of alcohol perform the HGN test?
Yes.
And how many times would you estimate you have performed this test over the course of your career?
Again, in the field, I performed this test approximately 30 times.
Can you describe, please, the full procedure for administering the HGN test as instructed by the NHTSA manual in accordance with your training?
First, you instruct the subject to stand still with his feet together, hands at his side, and to remain still, keep your head straight, and we tell him to take a look at the stimulus. The stimulus that I used on the day was just a pen that had a contrasting tip so that it was easier for the defendant to see and follow. And you hold the stimulus approximately 12 to 15 inches from the face, just above eye level, and you start by a few medical assessments, checking for equal pupil size, checking for resting nystagmus, because that would be an indication that something else was going on. We might have to get an ambulance there. And then you just check for one clue at a time.
Okay, and what are those clues that you check for?
Lack of smooth pursuit, distinct and sustained nystagmus at maximum deviation, and the onset of nystagmus prior to 45 degrees.
And is there a specific procedure for checking for each of those three things?
Yes, ma'am.
Okay. So for the first one, before you even do the lack of smooth pursuit, is there any other kind of tests that you're supposed to do?
Yes, after the medical assessment, you check to make sure that the eyes can track the stimulus as you move it from side to side equally. Pretty much you're checking to make sure that they can move their eyes and actually follow it.
So once you do that, you look for smooth pursuit, and can you describe how that stimulus, well, first of all, I'm sorry if I missed this, how far is that stimulus supposed to be from the person's face?
Approximately 12 to 15 inches.
12 to 15 inches, all right. And for lack of smooth pursuit, how are you supposed to move this stimulus across the eyes?
From the center line of the face out to one side, and back in about 2 seconds. And you start with the subject's left eye, and then you check the left eye, then his right eye, and then you check again for the same clue on each eye.
Okay. So you're doing it twice. You're looking for each thing twice, the lack of smooth pursuit twice in each eye?
Yes, ma'am.
All right. Then you mentioned distinct and sustained nystagmus at maximum deviation. What is the procedure for checking that?
You take the stimulus and you move it out until the subject's eye is at maximum deviation. And what that means is basically you're looking all the way to one side and there's no white left in the corner of the eye. It's as far as you can look to one side. You just hold it there for 4 seconds.
All right. And how many times do you do that for each eye?
Again, you check each eye twice.
Okay. The third part of this, you talked about onset of nystagmus before 45 degrees. What is the procedure for that?
In similar fashion, you start with the subject's left eye, and from the center line of the face out to about 45 degrees, which on most people is roughly out to about their shoulder. You just move the stimulus slowly, about 4 seconds, and you look for that involuntary jerking of the eye, the jerkiness of the eye, before you reach 45 degrees.
And it should take you, what you're saying is it should take you 4 seconds to get to the center to approximately the shoulder?
Yes.
Okay. All right, and after you conduct those three aspects of the test, what is the final aspect of the test?
You look for vertical nystagmus.
And what's that?
And you take and you raise the stimulus straight up, and again you're looking for that involuntary jerking of the eye in an upward motion, and that would just mean that the subject is at a very high BAC for that person.
Now, is it absolutely required that they be in a standing position under the training guidelines?
No, they don't have to be.
What about glasses, eyeglasses?
The defendant was not wearing glasses. You could have to take them off so that you can see the eyes, as long as the person is able to see the stimulus.
What about contacts? Is that a concern?
It was not a concern. I asked Mr. Mason in this case whether or not he was wearing contacts. He said he was. I asked him if they were bothering him, and he said no, they were fine.
Okay. Can you still do the test if a person's wearing contacts?
Yes.
What is it about the equal pupil size? Why are you looking for that?
Well, equal pupil size could be an indication of, like I was saying, medical issues that would require me to call for an ambulance and get him to a hospital quickly.
If you saw unequal pupil size or this resting nystagmus that you mentioned, would you continue the horizontal gaze nystagmus test or any other field sobriety tests?
No.
Now, you indicate that part of the instructions are they're supposed to follow the stimulus with their eyes only. Is that right?
Yes.
They're not supposed to move their head?
Yes.
Okay. Okay. More specifically now, can you tell us what you mean by lack of smooth pursuit?
Certainly. During when you're looking at the eye, it should just roll like a marble on glass, nice and smooth, just one side to the other. If there's a jerkiness to the eye, as though we're kind of going up and down, you know what I mean? Anything other than that smooth rolling is an indication of nystagmus.
Okay. I'd like to turn our attention to the horizontal gaze nystagmus test as you administered it to the defendant in this particular case. So I'll ask you specifically about that. You said you asked him to perform that test for you, is that correct?
Yes.
Okay. And did you have him stand in the proper position?
Objection, now we're leaving, Your Honor.
The answer or the question doesn't suppose an answer or suggest one, so I'll overrule it. Answer the question.
I had him stand in the prescribed manner.
Okay, and what was that?
With his feet together, his hands at his sides, and I instructed him to remain still and follow the stimulus with his eyes only.
Okay. And did you then conduct the test?
Yes, ma'am.
First of all, did you check, you indicated that did you check for equal pupil size in resting nystagmus?
Yes.
Were his pupils equal?
His pupils were equal in size, and there were no indications of resting nystagmus.
Okay. And after that, did you look for what you called equal tracking?
Yes.
Did you tell us what you saw there?
The eyes together followed the stimulus as I moved it from side to side, so he was able to track the stimulus properly. So I determined that he was able to actually take the test.
Could you describe what you observed next for the lack of smooth pursuit?
In checking for lack of smooth pursuit, as I moved the stimulus out from the center line, I noticed the involuntary jerking of the eye. He was not able to follow or track with his eyes smoothly. As I checked both eyes twice, there were indications of nystagmus on each of the observations. So.
And then what about the distinct and sustained nystagmus at 45 degrees?
Distinct and sustained nystagmus at maximum deviation.
I'm sorry. Thank you.
Was the next thing that I checked for, and so I brought the stimulus out. He followed it with his eyes until there was no white left in the corner, and as I held it there for 4 seconds, I noticed that there was an involuntary jerking of the eye for the duration of that 4 seconds while I held the stimulus out there. When I checked the other eye, again, there was a distinct and sustained nystagmus. Rechecking both eyes, there was indications of nystagmus.
And finally, onset before 45 degrees. Could you tell us what you observed there?
In bringing this stimulus from the center line out to approximately his shoulder, as I moved the stimulus, as soon as I began to move the stimulus, there was a jerking in the eye. I checked the other eye. Again, there was an indication of nystagmus before I reached that shoulder line.
Did you then do the vertical gaze nystagmus portion
Yes.
of it? And did you observe any vertical nystagmus?
No. In raising the stimulus from approximately the center of his face up to as high as he could look, I did not observe any nystagmus. There was no bouncing of the eyes in an up and down manner.
Now, when you first instructed him what you wanted him to do, did he appear to understand what you were saying?
He did appear to understand what I was saying. However, while I was checking for lack of smooth pursuit, he did turn his head, and I did have to tell him to keep his head still. He actually kind of turned his head and his body a little bit, so I had to recheck on one of those passes.
Did you make any other observations about him while he was standing in that position?
At times, he was swaying a little bit from right to left and just a little bit forward to back, but not enough as to render him unable to take the test, or for me to fear, for his safety, that he was going to fall over.
Can a person practice being able to pass the horizontal gaze nystagmus test or do well on it?
This is far beyond any relevance in this case, Your Honor. Object.
Counsel, your response to that?
It goes to his training and his experience, and talks about the relevancy of the horizontal gaze nystagmus test as an indicator of impairment.
Do we expect evidence, counsel, that there was some practice utilized by the defendant?
No.
Then I'll sustain the objection at this time.